Hello everyone, welcome to my YouTube channel Nursing Education. So today I'm going to talk about maternity nursing for the nurses and for the Nclex exam. So let's talk about gestation. Gestation is a time from the fertilization of ovum until the date of delivery. So is from the time when the ovum and sperm meet and the form zygote until the date of delivery. So it's about 280 days. Gravidity is referred to a number of pregnancy. So is the number of time women become pregnant is called as gravidity. A gravida is referred to the pregnant person. If woman is pregnant, the woman is gravida woman. Nulli gravida. So nulli is never and gravida is pregnant woman. So the person who has never been pregnant is called as nulli gravida. Primi gravida. Primi is once and the gravida is again a pregnant woman. So primi gravida is one who is pregnant for the first time. If the woman is pregnant for the first time, the woman is primi gravida woman. Multigravida. Multigravida, multi is more than once. So multigravida is again the pregnant woman. So multigravida is a person who has previously been pregnant, may have aborted or may have delivered a viable baby. So that's called the multigravida. Parity. Parity is number of birth. It's not number of pregnant, it's a number of birth. It's called as parity. Carried past 20 weeks of gestation, whether or not the fetus was born alive. So to be a parity woman, women should have carried the pregnancy until the 20 week of gestation. Whether the baby was a stillbirth or the baby was alive, it's called as a parity. A parity does not count the number of fetus, it just counts the number of time the woman given birth after the 20 week of gestation. Nulli para. Nulli is again never and para is the number of birth. So nullipara is a person who has not had birth at more than 20 weeks of gestation. So to be para, the pregnancy should end after the 20 week of gestation. So if the woman is pregnant and the woman had abortion at the 10 week of gestation, that woman is nullipara. But if that pregnancy ended after the 20 week, that called the primipara. So primi is once. Para is again the number of birth. So primipara is a person who has had one birth that occurred after the 20 week of gestation is called as a primipara. Multi is again more than one and para is number of pregnancy. So multipara is a person who has had two or more pregnancy which ended the stage of fetal viability. That is called multipara. Let's talk a little bit about GTPL. G is gravida, T is term, P is preterm, A is abortion, and the L is living. So G refers to gravidity. Gravidity is number of pregnancy, including the present one. So if the pregnant woman is pregnant for the second time, that is gravida 2. Twins only count once because woman was pregnant once only. So it was once pregnancy, not a twice, even with a twins baby. So that's why we count twins only once. T refer to the term birth. The number of baby born at term should be longer than 37 weeks of gestation. If the pregnant woman given birth at the 36 plus 6 week of gestation, that come under a preterm, not a term. So to be term baby, it should be longer than 36 weeks of gestation. And again the twins only count once. P refer to preterm birth, the number of birth women given before the 37 week of gestation. These are the birth between the 20 and then 36 plus 6 week of gestation, because before the 20 week of gestation we doesn't count woman in the para woman. So twins only count once. A refer to abortion or miscarriage. So the number of abortion or miscarriage, including in the gravida, if before the 20 week of gestation. So if woman had miscarriage before the 20 week of gestation, that comes under the abortion A. So real differ to living children. So this is the current number of children women have and that the baby is alive. Twins will count the twice here because we count the number of baby, not the pregnancy or not the number of time the woman given birth. So let's do this practice question. 31-year-old patient with a history of 2 miscarriages at 8 and the 18 week of gestation. Her first children were born at 30 weeks of gestation, twins born at the 38 week of gestation, and that are still living, and is current in her third trimester with a singleton pregnancy. So you can pause video here and you can calculate and you can see the answer in the next slide. So let's calculate the answer here. So 31-year-old patient with a history of 2 miscarriages. So for the 2 miscarriages, woman was pregnant twice. So one miscarriage ended at the 8 week of gestation and the second at the 18 week of gestation. Her first children were born at 34 week of gestation. So woman was pregnant again for the third time. Twins born at the 38 week of gestation. So woman given birth again twins baby at the 30 week of gestation. So woman was pregnant for the fourth time. And the is currently in her third trimester. So again the woman is pregnant and who is in the third trimester of pregnancy. So woman was pregnant for the 5th time. So it's a gravida 5. Let's see the T. So here you can see her first children were born at 34 week of gestation, which is less than 37 week of gestation, which comes under preterm. Twins born at 30 week of gestation, which is more than 37 week of gestation, so that is a term birth. So it's T1. And then P1 because her first children were born before the 37 week of gestation. Let's see the abortion. So woman had 2 miscarriages at 8 and the 18 week of gestation, which was before the 20 week of gestation. So that's come under A2. And then let's see the living children. So woman had given the birth at the 34 week of gestation and twins at the 38 week of gestation that are still living. So the one child at the which was preterm and the 2 child was term baby. So total 3 living children women have. So the answer is G5, T1, P1, A2, L2. So let's talk about the sign of pregnancy. So there are 3 signs of pregnancy. First one is a presumptive sign, second is a possible sign, and then positive sign of pregnancy. So let's talk a little bit about the presumptive sign of pregnancy. So first one is amenorrhea, where the woman stop having the menstruation if the woman is pregnant. Second one is a frequency of micturition, so woman has to go toilet like frequently, and this is due to the hormonal changes in the first trimester of the pregnancy, and in the third trimester of pregnancy it is due to the pressure on the bladder by the baby. And morning sickness, it is due to the hormonal changes in the pregnancy, especially the HCG hormone, human chorionic gonadotrophic hormone, and that make the woman to be sick, nausea and vomiting. Fatigue and tired is common in the pregnancy. Also, presumptive sign is a breast changes, where the woman breast will be tender during the pregnancy, and then areola around the nipple get darker and darker. And later in pregnancy, after 16 weeks of pregnancy, you can see the woman sebaceous gland around the areola will be more visible. And then after 16 weeks of pregnancy, women also have the milk production in the breast, and the little amount of the milk can be leak. Skin changes during the pregnancy is hyperpigmentation, especially in the face. It's called the melasma, and a stage mark. So in the beginning it looked like a red, and then it will become the brownish color. That is also called a steria gravidarum. Then also you can see the linea nigra, which is a start from the sternum to the lower part of the abdomen. It's like one line. And then also in some women you can see the acne and pimple in the face. And last one is a quickening, is a movement of the baby which is felt by the woman. So these all are the presumptive sign of pregnancy which is felt by the woman. Probable sign of pregnancy are the uterine enlargement. So as the baby grows, the abdominal of the pregnant woman get bigger and bigger. Second one is a Braxton Hicks contraction. So this is irregular in frequency and the less intense contraction, which can be go away by the movement of the woman and by the walking. Ballotment sign. So this is kind of the fetus can be palpated by pressing the finger into the vagina and tapping gently. So return of the fetus when tapped. So that is a ballotment sign of the pregnancy. Hagar sign is a compressibility and the softening of the lower uterine segment, and it is usually seen at the 6th week of gestation. Chadwick sign is a bluish discoloration of the vagina, vulva, and then cervix. Goodell sign is again softening of the cervix, and it is usually seen in the 2nd month of the pregnancy. The last sign is a positive sign of the pregnancy is definitely the woman is pregnant. So if you can see the palpable, you can palpate the fetal part, and definitely the woman is pregnant. Then the perception of active fetal movement by the examiner, it's not by the woman, it is by the examiner. Auscultation of the fetus heart sound, and ultrasound detect the fetus. Fetal heart rate detected by the electronic device. So these all are the positive sign of pregnancy. These are rules for estimating the date of delivery. So to calculate the estimated date of delivery, you can use this formula. Last menstruation period plus 7 days minus 3 months plus 1 year equal to estimated date of delivery. So LMP is last menstruation period. It is the first day of last menstruation period plus 7 days. So you have to add 7 days in the days of last menstruation period. You have to minus the 3 months in the month of last menstruation period and add 1 year in the last menstruation period year. So let's do this calculation. So last menstruation period is 10th of May 2023. You can pause the video and calculate and start the video, and you can see the answer in the next slide. Let's do this calculation together. So last menstruation period is 10th of May 2023. So based on the Nclex formula, you have to add 7 days in the date of days of last menstruation period and minus 3 months in the month of last menstruation period and add 1 year in year of last menstruation period. So if you calculate 10 plus 7 is 17, 5 minus 3 is 2, and then 1 year, if you add 1 year in 2023, it would be 2024. So the estimated date of delivery is 17th of February 2024. If you have any question, you can ask in the comment section. I'll be happy to answer it. Please subscribe to my channel and press the bell icon to get more video. Thank you.